want you to understand that we are not treating willpower, problem of willpower. Obesity is not a disorder of willpower. Okay, it's not that people don't know what they're doing. They know they should lose weight. They can't lose weight. There's a physical barrier. Some people can do it, and then everyone says, oh yeah, look, he lost weight. Why don't you lose weight? Right? So someone gets cured of their leukemia. Why doesn't everyone get cured of their leukemia? Okay, that happens. We had a patient who got cured of multiple myeloma. Like, I don't know how. Nobody can understand this. Why doesn't everybody get cured? We do not know that. But when you look at the patient who's obese, if you dare say that it's your fault, you are making a big mistake. Okay, you are never, in my opinion, you're never going to help that patient. It's you and the patient against the disease. You're on their side fighting against this. You have to use every tool at your disposal if it's medically indicated. So I'm not saying that you should use the kind of tools I'm going to talk about in people who are 5 pounds overweight. That's not medically indicated. Okay, but if someone has a health problem related to their weight, I think that kind of more aggressive treatment is clearly justified. So the flip side of this, possibly because of hypothalamic injury, is that when you try to lose weight, there is clearly a metabolic resistance. And this paper, again, is an illustration of what happens. In this study, there was about a 15% weight loss was induced using a liquid diet. And what the researchers saw was that there was a reduction in some hormones and an increase in others. Leptin was reduced by 65%, serum leptin concentration. So you heard, I'm sure, that leptin is like the gas gauge of your body. It tells your brain how much fuel is stored. When you lose 15% of your body weight, maybe you lose 12%, maybe you lose 20% of your body fat, but you don't lose 65%. You don't lose 65%. But the gas gauge is telling you lost 65%. So if you went through 65% of your fuel very quickly in your car, you'd go to the gas station. We think this is one reason why people get hungry, because leptin is an important cofactor in satiety. It doesn't give satiety, but without it, the other inputs coming from the stomach, intestine, and elsewhere don't function properly. If we look at the effect of reducing these hormones, it would increase appetite. And then on the other side, there was an increase in ghrelin. What happens when you increase ghrelin? You increase appetite. We think that this is an increase in ghrelin could be one reason why people fail surgery and the other types of treatments that we offer. We can't really do much about ghrelin. So the point is that there is abundant evidence, scientific evidence, that there is resistance to weight loss, which is physical, hormonal, and that is what we are treating. We are not treating a disorder of willpower. This is not lifestyle treatment. Okay? That is an important point. So we've gotten